Cool.
Is mental health something that should be taken seriously? Over many years, there has been a constant debate over the severity of mental health and the kinds of treatments that should be available for those with these health conditions. Oftentimes, you can hear people talking poorly about others with mental health disorders. She never wants to go out. She's such a loner. What is she, some kind of freak? This is not the appropriate way to look at mental health, as it is just as important as physical health problems. Mental well-being is the focus of the whole body, because if your mind does not feel well, how do you expect your body to feel well? When you hear the words health problems, what do you think of? The first thing that comes to mind is some form of physical health problems, such as heart issues, liver or kidney failure, maybe even a common cold. However, mental health problems are just as severe and can actually lead to some of these physical health problems. Anxiety and depression are two of the leading mental health disorders, and though many people understand the consequences of the two, they are not taken nearly as seriously as they should be. Studies have shown that nearly 70% of people who attempt or commit suicide have some form of an anxiety disorder. Many find this hard to believe because people associate depression with suicide far more often than anxiety, which is incorrect. The two disorders actually fall hand in hand more often than not, which can lead to more chronic course of illness, poor response to available treatments, and increased suicidal thoughts and attempts. Anxiety disorders can greatly affect a person's quality of life. Those with anxiety typically suffer from breathing problems, social isolation, fatigue, loss of appetite, weight gain, and many other health factors. A major health risk of anxiety is a possibility for high blood pressure and heart disease. Those with chronic forms of anxiety experience increased heart rate and breathing. These can be detrimental to a person's physical health and can cause irreversible effects. There are multiple different types of anxiety. Social anxiety disorder is the most common form, affecting over 15 million American adults every year. This is a medical condition where the individual experiencing it has a paralyzing fear of social interactions or being judged by others. The next most common form is generalized anxiety disorder, which affects over 6 million American adults per year. This disorder consists of excessive anxiety for no logical reason, meaning there is no specific trigger to cause panic in the individual. Other forms of anxiety disorders include post-traumatic stress disorder, obsessive-compulsive disorder, phobias, and panic disorders. 4 out of every 100 Americans have some form of severe anxiety disorder. However, only 1 in 3 people diagnosed actually receive treatment. Paying more attention to the symptoms and factors of anxiety can greatly improve the quality of life for those suffering from these conditions. Depression is equally as serious as anxiety, just in different ways. Depression affects over 300 million people worldwide and over 6% of adults, yet fewer than half of them receive adequate treatment. Depression is classified as a mood disorder that causes persistent feelings of sadness and causes loss of interest in everyday life. This can interfere with your physical and mental well-being as a whole. Depression ruins relationships, friendships, and even families. Loss of interest in hobbies, social outings, work, and normal life tasks can occur as a result of depression. It can lead to significant weight gain or weight loss, loss of energy, feelings of worthlessness or guilt, irritability, and memory and concentration issues. This leads to problems with communication, workplace issues, and some serious lifestyle problems. If we as a whole paid more attention to the severity of depression, many lives could be changed for the better and society would be all around happier. There is a common stigma that men should not pay any mind to their mental health. From a young age, men are told to be tough. Don't cry, you're not a girl, get up, don't be a baby, walk it off, be a man. These words are ingrained to the brains of boys from early childhood on. Men who develop depression and anxiety often find trouble getting medical help because they struggle to admit that they have a problem. Women are twice as likely to develop anxiety disorders, but men die from suicide 3 to 5 times more often than women. This is significantly influenced by the way boys are brought up to be tough and strong and to ignore their emotions. Mental health is nothing to be brushed to the side and should be more of a focus in our society, because if we paid more attention to it early, we would be able to get proper help needed and get a hold of the problem before it spirals out of control. Ignoring mental health signals can lead to very serious health problems as well as diminish the quality of everyday life. Those who ignore their mental health tend to turn to outside substances such as alcohol or drugs to make themselves feel better. Alcohol can cause damage to one's liver and kidneys if used in excess. Drugs are highly addictive and can ruin relationships and lead to death if overused. Those who ignore their mental health also tend to have trouble sleeping or sleep too much. Those with chronic forms of depression often find themselves glued to the couch, either binge watching television or staring at their phone. This can lead to weight gain, lethargy, insomnia, and body aches. Focusing more on the symptoms of anxiety and depression can lead people to get the treatment needed and spare people the detriment of potentially ruining their livelihood. There are multiple different ways to get treatment for mental health problems. Depression and anxiety can both be treated with the use of medications or psychotherapy. Not all medications work the same for everyone, and many people have to go through experimenting with different medicines before they find ones best suited for them. Psychiatrists usually recommend that a person stays on medication for 6 months to fully acclimate to it and see how their brain reacts with the chemicals. This could lead to years of trial and error before finding a well-suited medication. This is the leading reason why people with depression and anxiety wind up untreated or unmedicated, because to them, the hassle of experimenting with medication isn't worth it. However, once an individual finds a medication best suited for them, the quality of their lives can increase exponentially. Psychotherapy, another great option for depression, involves sitting down with a medical professional to talk about issues and help address them together. If more people were aware of their options for help and paid more attention to their mental health, less people would be left untreated. The focus on mental health needs to change. Rather than being looked at negatively, people need to be more encouraged and to embrace their mental health problems and seek the treatment they need immediately rather than waiting until it could be too late. Mental health problems tend to arise in early teen years and progress later into adulthood. Talking to children about these issues can greatly help them understand why they feel the way they do and potentially make them communicate their feelings better. This goal is not to shame, nor should it ever be. The goal is to see growth in those with these health issues, and the best way to do that is to take them seriously.